Hi, this is Dr. Saxena, and we'll be talking on the things. We started with the mouthwash, and I'd like to talk about something which everyone uses on a daily basis, and without that, your day doesn't start. Yes, I'm talking about something on toothpaste, and though I believe there is an integrative medicine approach, what is the kind of toothpaste you are using, and let us see what other things are on the plate so that you can always decide what best thing is to be done particularly. Toothpaste is a paste used for cleaning the teeth. That's simple. It's also known as dental paste or dentifrice. And see, the idea of using the commercial toothpaste, I'm talking toothpaste are all commercial, is to inhibit the formation of calculus. Calculus is it's something like what happens is calculus formation of are always happens between the tooth, and this we call the toothpaste which inhibit the formation of calculus as anti-tartar toothpaste. So you have got Colgate Total toothpaste, you have got Colgate Tartar Control toothpaste, you have got Pepsodent Ultra toothpaste, and see, you have got there were studies which were done with the placebo, and the the capacity to inhibit the formation of calculus was compared with the this one placebo, and it worked. Toothpaste also contains something like fluoride, which helps reduce the tooth decay. Coming to the constituents of this toothpaste, what is abrasives are used? Usually, there are calcium hydrogen phosphate is used as an abrasive constituent in most of the brands of toothpaste. The other one thing which is used very commonly, sodium bicarbonate. There is a aldehyde which is used called cinnamaldehyde. There are detergents which are used in toothpaste. Something is called sodium lauryl sulfate. You should remember this name because this is very nasty thing, and it's used in a lot of things including vaccines. There is one more thing called CAPB, which is commonly used as a detergent in commercial toothpaste. Though the quantity is very less, but you need to always understand this is a detergent. Fluorides, what are being used, they are used in different forms, usually acidulated phosphate fluoride or amine fluoride, your sodium fluoride, different kinds of combinations, and sometimes you use something like stannous fluoride, stabilized or non-stabilized stannous fluoride. Stannous means you have got tin into that. So this sodium fluoride is the most effective topically bioavailable fluoride which is available right now is the monofluorophosphate, sodium monofluorophosphate. What happens here is you need to know what is the content. Usually the content is 0.15, maximum fluoride content is 0.15, but I had seen people using up to 6% fluoride also, which is a it's slightly a cause of worry. Fluoride in toothpaste of that thing, something like 30 times, 20 times more than that. It's a problem. Some of the toothpaste now we do get the advertisement calcium and all that. Yes, calcium carbonate is an active ingredient in most of this. We are talking about something like glycerophosphate, we are talking about sodium tripolyphosphate. These are all the things which sodium tripolyphosphate, interestingly, is an active ingredient in whitening toothpaste. You have Maclean's whitening toothpaste which has got 10% of sodium polyphosphate. There are some commercial toothpaste which contain something like aluminum. There are some commercial toothpaste which contains lead. From where this lead is coming from, this aluminum is coming is from the toothpaste packaging. This is one thing which we need to. There are I had gone into a depth and I looked some things. Chloroform also was some of the constituent in that, and there was something like carrageenan, which is a thickening agent used for most commercial things. So what happens with all this stuff, with this all combinations, the constants of some this toothpaste can cause allergies in some. It's because of the cinnamaldehyde usually, which is added as a this one. Cinnamaldehyde has a lot of toothpaste which contain sodium lauryl sulfate, that is the detergent, increases the incidence of desquamation and irritation of the oral mucosa. Uh, so that is one thing which I always try to tell people to be careful what are the things which are there. Try to look into the active ingredient of what is there in the Colgate. I can tell you Colgate, when I look into that, I have got something like triclosan, I have got something like titanium dioxide, I have got LS, you have got sorbitol, all these things. Particularly fluoride, you have got silica, I have got fine, but some things are really, it can cause some problem with at least I can say 7 to 8% of people. 7 to 8% of people is a big thing. You need to be careful what you are, people who are allergic, people who are having migraine, people who are having some nasty sinusitis, they are having some problems with their autoimmune problems and all that. They need to be careful about all these things what I'm talking about. And yes, there are some whiteners are there, which is whitening thing, which has got high levels of fluoride, which has got sodium tripolyphosphate, or to the extent of 10%, which is really a problem. You have got something like stannous fluoride. Absolutely no for that particular thing. Never get into this particular stuffs. So here you need to definitely look at the teeth, try to work on some things which are really important. At the same time, what you are talking is trying to see that, keep a watch what are the contents and all that. Don't try to overdo things. And yes, you need your healthy teeth, you need your healthy gums, you need your normal oral health, and definitely you need to use a toothpaste. What I am telling is, try to follow these constituents. If you are having this kind of constituents and all that, try to be careful with the fluoride, try to be careful with the carrageenan, try to be careful with the SLS, sodium lauryl sulfate. These are the things which are really not in this one. And a lot of stannous fluoride. This is something which is, you can always use a simple kind of this one. Try to use all these things, and you need to keep a good oral health and go by your dentist advice. Sometimes some people are more sensitive to something and like that. So you need to work on this. Why I'm so worried about this fluoride is one thing. Fluoride it's a good thing as well as a bad thing. It has got some good effects and some bad effects. What are the I'll talk about the toxic symptoms first. What are the excessive fluoride consumption can cause? Excessive thyroid function first decreases your thyroid function, slows down your thyroid function, and causes hypothyroidism. It can cause something like carpal tunnel syndrome. During pregnancy, it can cause problems with the offspring. These are the major things, which is thyroid is a big thing with fluoride, every fluoride. So fluorosis, and I have seen people in areas with fluorosis also start using fluoride is in sheer people are not aware about this particular thing. So fluoride, what happens is that it interferes with magnesium. Magnesium is such an important mineral. It is used in more than 300 enzymatic reactions, and if you don't properly manage your magnesium, you are not going to get. You are getting into definitely a lot of problems. What are the healthy effect, good things about fluoride? I must tell you, it strengthens the blood vessels. It works well with the varicose veins, and people with hemorrhoids can use fluoride. It helps. It strengthens the blood vessels of the anus. In detoxification also, fluoride inhibits the absorption of aluminium. So aluminium is competitively absorbed. So when fluoride is there, aluminium is doesn't get absorbed in the body. Fluoride helps in a lot of ways, improving the strength and stability of the bones, soft tissues, collagen, and all that. So, but this fluoride, if it is in excess, it's really a problem. So, try to look into what we are trying to understand with a lot of thing, and yes, you need, at the same time, you need good oral hygiene products also. Try to look into what are the things which we are talking about, and take your own decision. Try to stay healthy, and don't get into the trap of the disease. And that's the very first thing about integrative medicine is optimize your health. And when you optimize your health, you don't get into something a disease problem. That's it. Thank you.